Welcome everyone to an important conversation on two pressing health issues that affect millions of women across India. I'm Miloni Bhatt. As we mark International Women's Day, we delve into heart disease and diabetes in women in India with an esteemed panel of experts. Two formidable adversaries, heart disease and diabetes, claim an alarming toll on women's lives in India. According to Global Burden of Disease study, heart disease stands as the leading cause of female mortality in the country, surpassing even the combined impact of breast cancer and other malignancies. The statistics are sobering. The prevalence of coronary artery disease in Indian women has soared by nearly 300% in the past 2 decades, with heart failure rates doubling. Furthermore, the epidemic of type 2 diabetes, particularly among younger demographics, poses a grave challenge. To shed light on these two critical issues, we are privileged to have a distinguished panel of medical professionals, starting with Dr. Sarita Rao. She is a seasoned interventional cardiologist and director of the Cath Lab at Apollo Hospital, Indore. Welcome, doctor.
Thank you.
We have with us Dr. Shehla Sheikh. She is a consultant endocrinologist from Sefi and Reliance Hospitals in Mumbai, specializing in diabetes management. It's a pleasure to have you here with us, ma'am.
Thanks, Miloni. Pleasure being here.
It's our pleasure. And we have with us Dr. Anupama Dubey. She's a consultant diabetologist at Maharishi Diabetes and Foot Care Center in Indore. And she brings invaluable expertise in tackling the complexities of diabetes. Welcome to economictimes.com, ma'am.
Thank you, Milani. It's great to be here.
All right. Together, these experts will spearhead our discussion on winning the battle against diabetes and heart disease in women. Dr. Rao, we have two startling data points. A recent study by Harvard T.H. Chan School of Public Health highlights alarming rates of diabetes among middle-aged women in India. Out of 640 districts that were surveyed, 254 have a startlingly high prevalence exceeding 10%, with 130 of these falling into moderately high range of 8.7% to 10.6%. Adding to the concern, a report from the Registrar General of India underscores cardiovascular diseases as the leading cause of death among women. So if we start with heart disease, why is there an increased risk of heart disease among young females? And are there any particular signs and symptoms that they should be aware of?
Miloni, you brought about very interesting fact. And today, with the spate of young deaths which are occurring, it's not just men, not just women, but men also. Now, women are unique in the fact that they have different risk factors also. For example, a woman is unique in the fact that she gets pregnant, she has menopause, all of these things which are unique to a woman. So we have things called traditional risk factors for women, and we have things which are unique to women. So when you talk about things which are unique to women, is that they undergo hormonal changes, and these fluctuations typically occur during pregnancy and when they have menopause. And we do see a lot of early menopause nowadays too. And these hormones, they influence the cardiovascular health. At the same time, women frequently take birth control pills, and these pills sometimes predispose to thrombosis. Also, women frequently have some autoimmune disease, and these again have association with cardiovascular health. Traditional risk factors are also seen in women. For example, you talk about diabetes, which you've elucidated so well upon. Then stress and depression, especially during pregnancy and the postpartum phase. And a lot of other things like peripartum cardiomyopathy, increased incidence of SCAD, which is seen in pregnant women. All of these affect the heart health. Now, signs and symptoms when we talk about for women, we have to say that women present slightly differently than men. So what is typical for a man may not be typical for a woman. A woman presents in a different way. For example, she's less likely to complain of the traditional chest pain. She's more likely to complain of maybe a breathing difficulty, a fatigue, a tiredness. She's also likely to complain of a general feeling of not being well, nausea, dizziness, all of those things, acidity predominantly. Yes, and 50% of women also complain of pain, but not traditionally left-sided pain, They may complain of jaw pain, shoulder pain, back pain, central chest pain, or maybe both sides. So all of these symptomatology needs to make you alert. When a woman says that she's not feeling well, take it seriously. Get her checked out. It's not just tiredness with housework. There's something wrong.
Okay. Dr. Sheikh, if you could expand on what Dr. Rao has just told us, and she touched upon hormonal imbalance. Could you talk to us about the symptoms of hormonal imbalance in women?
Thanks for that, Miloni. To be very honest, Miloni, the term hormonal imbalance is sometimes used, very arbitrarily. It is a statement which is just made, oh, this person has hormonal imbalance. But we need to understand that when we are talking about hormonal imbalance, hormones are basically chemical messengers which are secreted from endocrine glands, which are going to act on different tissues of your body. And it is very important that they are maintained within the range that they are supposed to be. I mean, even over-functioning of a gland or under-functioning of a gland, both would be basically termed as what we are commonly calling hormonal imbalance. Now, when I talk about endocrine glands, when we talk about the various endocrine glands, I'll talk about the two most common endocrine glands as far as women health is concerned, the thyroid and the ovaries. For example, a patient who has a hypofunctioning thyroid, which again is a very, very common disorder diagnosed in women. These patients could come to you with some amount of weight gain. They could come to you with hair thinning or hair loss. They can come to you with a lot of fatigability, they can come to you with constipation, sometimes infertility, irregular cycles, dry skin. Sometimes the patient can just come to you with mood swings. So there are a number of symptoms which the patients can come to you with. But what is very, very important that each patient may not have all the symptoms. So we need to have a high index of suspicion, yes. But at the same time, we also need to understand that a patient is not interpreted only according to lab reports. What is increasingly happening is that patients are undergoing a huge amount of tests, and patients are being treated according to tests. I think it's very important that you put across to the patients that there's a lot of holistic approach when you're looking at women health. You cannot just interpret hormone numbers in isolation. Patients often feel like, ma'am, I have this issue, but they may actually not be having that issue. There may be so many other explanations for that. Another very common problem, hormonal imbalance, Miloni, can manifest in different ways at different ages. For example, if I look at the reproductive axis, in a young patient, it may manifest with PCOD, which may manifest with irregular cycles. It can manifest with a patient putting on weight gain, hirsutism, hair fall. And in a patient who's in the middle age, or for example, in the reproductive age group, it can manifest with infertility. It can manifest with low libido. And as Dr. Rao just alluded to, in the patient who's postmenopausal, it can manifest with cardiovascular disease. So there's a whole gamut out there which needs to be interpreted accordingly, Miloni.
All right. No, obviously, and we don't have a lot of time to actually delve into it, but, each aspect of a woman's health is a whole webinar. And but thank you very much for giving us a very detailed response to this. Dr. Dubey, to you. A study published in 2020 in the Journal of Diabetes and Metabolic Disorders found that over 1 in 10 women aged 35 to 49 in India have diabetes. Policymakers are also considering a more inclusive approach to diabetes prevention, management, and recognizing the hidden challenges that women face due to lack of awareness and unseen obstacles. What complications, could arise from diabetes? How frequently should women of various age groups monitor blood sugar levels?
Yeah, Milani, this is very good to know about the inclusivity of the women population in diabetes study. If we just talk about the complications associated with diabetes, I would say diabetes affects both men and women from tip to toe. It would be like very surprising to know that roughly the risk of CAD in patients in women with diabetes, the risk is almost 4 times more than compared to males. Again, this might be because of the hormone reasons, as Dr. Rao said. Then there is also increased risk of other diabetes related complications, like there might be retinal diseases, there might be kidney disease, which we call as CKD and all. There might be increase in neuropathy, that is in general we call as nerve damages. And specifically, if we talk about the women, there would be increased cases of UTI, urinary tract infection, which would be like because of the hyperglycemia, there might be a painful urine, there might be burning, and there are increased vaginal fungal infections as well in women who have diabetic. They might come as itching, discharge, painful sex, and soreness. Also, in diabetic women, we have seen a frequent correlation with PCOS, which is very common nowadays. That is polycystic ovarian syndrome. And this insulin resistance, it causes PCOS, whereas PCOS might be a cause of diabetes. So both affect each other as such. And this might be characterized as irregular periods, weight gain, acne, and a lot of depression plus infertility. Now, if we talk about how frequent we should check the blood sugars, I would say that is very subjective. Like if it's a case of type 1 diabetic patient, we might be checking the blood sugars very often, say 4 to 6 times even. But if it is a stable patient, that would definitely depend on, like, if he has just underwent a change in the treatment by the doctor, she might require frequent examination of the blood sugar. But if it's a stable patient, even once or twice a week should be fine. Especially the patients who are on insulin, they require more frequent checkups on blood sugars. And nowadays, this CGM has come, that is known as a continuous glucose monitoring. It's a very nice tool for a stable blood sugar,
Right.
especially in those patients who have lots of ups and downs. So that's a very good tool to monitor the blood sugar levels.
All right. Thank you very much for that response, Doctor. Dr. Rao, to you, and again, touching upon something that you spoke of initially, according to a recent Deloitte survey spanning 10 countries, including India, more than half of working Indian women reported increased stress levels in FY23 compared to the previous year, surpassing the global average. Additionally, 31% admitted to feeling burnt out, higher than the global average of 28%. Meanwhile, prevalence of common mental disorders like depression and anxiety is also escalating in India, with rural women facing heightened risks due to socio-economic factors. Dr. Rao, talk to us about how significant is stress in impacting heart health, particularly for women.
Melody, this is a very interesting subject which you brought up. When we talk of stress, it's everywhere. Today, everyone, men, women from all social strata and of all ages are facing tremendous amount of stress. And that's because of the way the lifestyle has changed. That's because of the urbanization which has occurred. That's because of the way that the pattern of living has changed. Nuclear families, the drive to succeed, the stress level is tremendous. Now, when I talk about stress, it's there in men, women both. But in women, when you talk of stress can lead to an increase in your blood pressure. And increase in your blood pressure is adverse for your cardiovascular health. Stress can also lead to hormonal imbalances. And these stress hormones can actually increase the inflammation in the blood vessels all over and predominantly in the heart. And when people have stress, they end up using, unhealthy coping mechanisms. And these unhealthy coping mechanisms are what? Overeating, substance abuse, smoking, increasing the amount of drinking that you're taking. All of these adverse for the heart. Mental health issues which come in, stress leads to depression, anxiety, all of these bad for your heart, and ultimately sleep disruption. So stress is a whole gamut. And it affects the whole body adversely and worsens the cardiovascular health. When you look at a study which we looked at, there's a 21% increased risk of heart attacks if you're having chronic stress. And the stress level is there everywhere. We recently did a survey for doctors, particularly in 23 states, doctors we evaluated. And in the survey, you'll find out that among doctors also, high stress levels and burnout symptoms were there in 33% of the doctors pan India. So how sad is that? Now, quickly, before I finish, I'll just say, yes, we all have stress. We have to find ways to cope with it. Let's be proactive, deal with our stress. How do we deal with our stress? Very three simple: jam out, work out. Listen to music, work out. Physical activity, exercise really helps you deal with stress. Ease your mind. Whatever eases your mind. It's yoga, it's meditation, it's gardening, it's cooking, it's dancing, it's singing. Do it. And get social. Don't stay alone. Go out with that girls group. Go out with the family. Sit with the people you never had time to interact with. Deal with your stress before it gets you.
Right. All right, Doctor, very good points. Dr. Sheikh, if you could add to it, stress and hormonal fluctuations during, say, pivotal life stages, puberty, pregnancy, menopause. When you have a combination like that, what are the implications for women's heart health?
The implications for women's heart health as far as the entire lifespan is concerned is very, very significant. For example, if you look at our adolescent girl children at this point of time, they are dealing with a lot of peer pressure, a lot of pressure to look just right. I mean, they have so many body image issues which are translating into health issues at this point of time. We are seeing an increasing incidence of not only obesity, which does translate into cardiovascular risk later, for example, insulin resistance, dyslipidemia. We are seeing our adolescent patients coming to us with hypertension, with full-fledged type 2 diabetes. So we need to hit really early and hit really hard. Because unless we make a change right over there, we're not going to be able to make a change across that lifespan. When you look at the other very important aspect which Dr. Rao alluded to, she was talking about pregnancy being one of the factors which really differentiates women from men. Again, pregnancy, when you look at pregnancy, we call it I'm sure Dr. Rao is going to agree, we call it a stress test for the heart. Because a patient who develops, any kind of gestational hypertension, who develops any kind of gestational diabetes, is at almost a 5 to 7 times increased risk of developing diabetes or hypertension later in life. So you have these window periods where with proper counseling, with proper care, with proper advice, and if you can make that change of lifestyle, you could potentially prevent all these problems that are, increasingly prevalent in our society to a significant extent. As far as menopause goes, Melanie, estrogen protects your heart till menopause. So that's the reason you have lower incidence of cardiovascular disease when you are younger. I mean, estrogen is actually a fantastic hormone in that sense. But as menopause brings with you not only a loss of estrogen, but it also brings to you along with that a lot of mood changes, a lot of bone changes, a lot of obesity. It affects your metabolism. And most importantly, Melanie, I think women just don't pay attention to themselves. I think that is what we really need to change. We need to make women aware that they are important. They are very important. I mean, we comprise 50% of society, but you would always see there's a skewed, attention over there. I mean, if a male patient has a complaint, it's given more attention than when a female patient is having a complaint. And I think that needs to change. And that is going to require a complete society's thought process to change before we actually get there, Melanie.
See the difference, right? And this actually brings to my next question, and Dr. Dubey, it is to you. Partly what ma'am has just spoken of, Shahla ma'am. Studies show that while diabetes affects more men, a concerning number of individuals remain unaware of their conditions, and most of them are women. Symptoms in women may be more subtle, perhaps unique, posing a greater risk of complications like, say, heart disease, kidney disease, and even mental health disorders. Talk to us, doctor, of the lasting impacts of untreated diabetes and how can women manage it effectively?
Yeah, Melanie, we talk about the long-term effects of diabetes. You can broadly, categorize them into, theoretically into 2 types of problem. There can be the macrovascular problems, which comprise the mostly heart diseases, the peripheral arterial diseases, and the cerebrovascular diseases. And if we talk about the microvascular, like little vessel disease, they are the diabetic retinopathy, which involves the retina, nephropathy, which involves kidney, and neuropathy, which involves the nerve. Now, these nerves can be the sensory, motor, autonomic, all. But the good news is that you can certainly prevent the long-term effects of diabetes. How? Like, first thing is a regular screening. And nowadays, with increased awareness, especially in women, I would say that a lot many women are coming up with the regular checkups. Unlike the older times when only men were like, because they were the bread earners, they used to get the regular checkups, and females used to be at home, and like for them, health was a secondary thing. But nowadays, even the women are coming up, getting regular screenings and checkups. So, how can we prevent? That's a very important thing to know. See, apart from a good sugar control, blood pressure control, cholesterol control, you have to maintain a healthy weight. Nowadays, there are many women groups coming up for regular exercises, Zumba, dancing with music and all. So, a regular exercise, a good weight control, a balanced diet, and quitting, of course, the smoking and alcohol. That's a regular thing to do. And apart from that, if a regular screening is done, say for eye checkup, if you can go to a doctor at least once a year, that's not much, or a regular blood screening for, there are simple tests. These are not very costly tests which will, cost you much. A regular screening of the urine, a regular blood checkup, which, the blood sugar levels, they should be fine. And for neuropathy and all, a simple monofilament test, it costs nothing to the patient or the doctor. A simple monofilament test touching that filament to the feet to find out if the neuropathy is developing or not. So these are simple things. ECG once in a year or twice, maybe, once in 2 years, that should be sufficingly telling you. And a Dopplers, if you find any changes, a regular Doppler, the foot should be telling you if there is any risk involved with the neuropathy. So,
Ma'am, just to intervene over here, you spoke of ECG. Is there a particular age at which women should start monitoring, their ECG levels, as you said, once a year?
ECG is basically the electrocardiogram. Yeah. So I think, as Dr. Rao said, the perimenopausal age group is the right time for this checkup. Though after COVID, I cannot say that there's a appropriate or there's a particular age group. Nowadays, I've seen young girls getting heart attacks all of a sudden after COVID and vaccination. But usually, this perimenopausal age group, these women should go for a regular ECG checkup once in a while. And I think Dr. Rao can tell you better on this.
So, Meloni, when we talk about ECG is a very basic test. You can go to any clinic, any nursing home, any hospital emergency and get an ECG. But when to get an ECG? What happens normally is that an ECG is done when a patient complains of either chest pain or a breathing difficulty. Now, let me say, there's no real particular age at which you say, because there are a lot of children out there who have congenital heart disease. And how do we pick it up the first time? The first time we pick it up is when the school holds a health check, a medical checkup for the kids in the school, and they do an ECG and somebody says, oh, this is abnormal. So you can pick up a lot of things with an ECG. You can pick up heart conditions, you can pick up congenital conditions, you can pick up a heart attack, you can pick up lung conditions. So there's no particular age. We always say that health checkups, screening health checkups, everybody above the age of 25 should have an annual health checkup. And an annual health checkup incorporates a bunch of tests in which ECG is also included. So everybody above the age of 25, blanket statement, get your annual screening done.
All right, doctor. And, could you add what steps can women take to prevent or reduce the risk of heart disease?
Meloni, most importantly, women have to learn to prioritize themselves. In India, particularly, and in the world over, women always prioritize others. They put their family first, the children first, the husband first, the elderly parents first. They never take out time for themselves. You know, we used to say that you educate a woman, you educate a whole family. In the same way, if there is a healthy woman at home, the whole family is going to stay healthy. And that's why a woman needs to learn that it's okay for me to take me time. 1 hour of a day devoted entirely to me and to me being healthy mentally, physically. What are the things she needs to know? Know her numbers. What's her blood pressure number? What's her cholesterol number? What's her sugar number? She rules out 3 things with that: diabetes, high blood pressure, and dyslipidemia. So know your numbers. Now, second thing, eat healthy. Small portions, veggies, fresh fruits. Eat healthy in small portions. Third, enough sleep. A woman is always the last person sleeping at home and the first person to wake up. Don't do that to yourself. Get your 8 hours of sleep daily. Don't smoke. It increases the risk of heart disease 3 times. Limit your alcohol consumption. Know what is your family history. Do you have an aunt? Does your mother have heart disease? Does your father have heart disease? Does your brother, sister have heart disease? Maybe you could also have it. It's genetically transmitted. Know your history. Control your chronic conditions and regular exercise. That me time, half of it is to be spent on regular exercise. So women, prioritize yourself out there. Look after yourself. You are important. And it's only if you stay healthy that the whole family is going to be okay.
So very powerful message, Dr. Rao. And I think, a very simple message, but often, as you pointed out, very easily overlooked. Dr. Sheikh, to you, there's something that I wanted to speak about is bone health, because also for women, I think that is very important. Talk to us about what diabetes does to bone health.
Miloni, diabetes and bone health is actually, very complex. They have a very complex relationship with each other. First of all, thanks for bringing that up, because I think, bone health is one of the most neglected part of health as far as a woman is concerned. And because osteoporosis per se is a silent disease, it is often not given any attention to. Now, when you look, if I talk about just a diabetic patients, unfortunately, when we are evaluating bones in our patients, we do conventionally what is known as a bone mineral density. That is commonly called a DEXA test. But the bone mineral density may actually not pick up a weak bone, because the bone mineral density, as a result of obesity, insulin resistance, and so many other factors, may be just within the normal range. But it is the bone microarchitecture which is actually degraded as a result of diabetes, and the bones are more fragile. So you tend to fracture yourselves more easily, especially if you have a fall, even something which we call a pathological fracture, where you just have a simple fall and you fracture your bones. And apart from that, even healing of the bones is much more longer and takes a much more longer time in patients with diabetes, because when the architecture is not very good, and when the there has to be a certain turnover in the bone. When that is affected as a result of diabetes, the bones are not going to be very healthy. There are also certain drugs which, can influence bone metabolism. For example, there are certain drugs like thiazolidinones, there are certain drugs like SGLT2 inhibitors, which can potentially influence bones. And especially if you're using them in postmenopausal women, then you need to be a little more careful. And the best way, Miloni, to prevent this is through resistance exercises, doing the right kind of exercises. As Dr. Rao has been saying, that, taking out that, I really don't know about the 1 hour, Dr. Rao, but I think even if they can manage a half an hour, that was, to do some, and it's very important, especially as you grow older, to do resistance exercises. I mean, a lot of patients will do some kind of aerobic exercises, for example, walking, but 3 days a week, it is mandatory that you do resistance exercises if you really want your muscle and bone health to be at peak the way it should be, irrespective of your age.
All right. No, very good points. Dr. Dubey, everyone's been speaking about eat healthy, eat right, eat small portions. But, often there is a lot of confusion when it comes to diet and managing diet with diabetes. So any dietary adjustments that are advisable for women with diabetes?
Yes, Melanie, though there are, n number of diet plans and diet, advices on Google, on everyone. But I always advise my patients one thing: do a diet which you can follow throughout your life. So you don't need to go to those sickly diets of eating the boiled veggies and the green
Right.
veggies all the time, and you'll be, after 3, 4, 5 days, you'll keep that diet chart on the last page of your file, and you'll never
Follow
ever
it.
be seeing that. Yes, usually the patients do that. So I always tell them, do what you can do forever. In general, it has been seen that diet has a remarkable effect on controlling your diabetes. Simply, if you divide your plate into 3 portions, the half should be, the green vegetables. Half of the half, the quarter should have starches and the protein and the fats, and the rest quarter should be the protein. This is in general a plate. So you can
Right.
go for any vegetables available at your place. You don't need to go to those quinoa and almond milks and the almond atta. Don't go to those fancy things because you won't be able to eat them throughout your life.
Right.
Whatever the budget of a family is, you are at an urban place, you are at a rural place, it doesn't matter. You can always have a healthy, balanced diet at your place. There are so many, with the millets coming up, with the awareness to millets, even at villages, people can eat the millets, bajra, jowar, soya, everything is available nowadays. That's not too pricey to eat. So have a healthy diet. Of course, go for exercises, go for non-starchy foods, go for green vegetables, go for, quit alcohol, quit smoking as much as you can, and stay happy. I would say that's the best thing. Whatever you eat, you don't need to go for the sickly diets and, you'll feel bimar for the whole life. You don't need to do that. Stay happy, take your time out, and whatever healthy is available at your place, go for that. There's
All right.
absolutely no diet, no universal diet which is like eat this, you'll be healthy. It's nothing
Right.
like that. Being happy is the healthiest part.
All right. Love that line. And finally, to each of you, and actually, Dr. Anupama, starting with you, one quick tip for women striving to lead a healthy life.
I would say, you are special. God has made you special. I was just listening one talk in Stanford University. There was this lady, I don't remember the name, but she was addressing boys and girls, whatever you are, whatever sex you have, be a feminist. Now, what do you mean by feminist? She meant that, the society, the family, the nation where women are respected, where they're taken care of, that nation, that society, that family grows in a very
Flourishes.
beautiful way. Yes,
Absolutely.
yes.
Right.
So take time for yourself, keep yourself healthy. I would say keep you first. No, of course, good to give care to yourself, and you'll be able to take care of the whole family, society, and the nation.
All
So
right.
you're wonderful, you're beautiful. Just believe in that.
Right. Prioritize yourself. All right, Dr. Sheikh, you next. One tip for women striving to lead a healthy life.
Invest in yourself, it always pays off.
It's a fantastic message. Dr. Rao, you have the last word.
So much has been said, Meloni, and I already emphasized the importance of prioritizing yourself. One last formula for good heart health. Follow the formula of 80. You want to remain 80? You want to remain fit and active? The formula of 80, that's ABCDE. A, your abdominal girth has to be less than 80 centimeters. B, your blood sugar, your fasting sugar has to be less than 80. C, your cholesterol level, the bad cholesterol, the LDL cholesterol, less than 80. D, diet, eat less than 80 gram of caloric food in any meal. E, exercise half an hour daily. You can't do that? Take 80 minutes at least in a week. So just follow the formula of 80 to remain 80 fit and active.
All right. Fantastic. The formula of 80 to get to 80 Thank you so very much. As we wrap this very enlightening session, I'd like to extend a very big thank you to all of you, our incredible panelists, Dr. Sarita Rao, Dr. Shehla Sheikh, and Dr. Anupama Dubey. Your expertise and passion for women's health have truly made a difference today. And as our experts have informed us, tackling heart disease and diabetes is more than just treatments. It's about empowerment, education, building a healthier future for everyone by prioritizing yourself. So let's keep this conversation going and work together to make a positive impact. For all of those eager to learn more, do not forget to check out our other webinars on heart and diabetes management on economictimes.com. I'm Meloni Bhatt, and once again, a huge thank you to all our panelists and to you, our wonderful audience. Until next time, stay informed, stay healthy, and keep striving for better health for all women. Thank you.
Thank you so much.
Thanks, Meloni, for being a wonderful host.
We had a wonderful time with you. Thank
Yes.
you.
Thank you so much. We had a wonderful time, and we're so fortunate to have the three of you, to enlighten us on so many important aspects of diabetes and heart health. So thank you so much for taking time out for us.
Thank you.
Thank you.
Thanks, Dr. Rao. Thanks, Dr. Dubey. Thank you very much.
Thank you. And nice interacting with both of you. Anupma, see you soon.